Hello everyone. In this video we are going to discuss about occipital bone. Now this is a curved bony plate which has got a foramen magnum in the center, and this foramen divides the occipital bone into four parts, namely squamous part, which is a quadrilateral bony plate extending above and behind from foramen magnum. So this is squamous part. A thick bony bar directed forward and upward. So this is basilar part, and two bony projections on either side of the foramen magnum, which is termed as condylar part. So this is condylar part. So there are four parts of the occipital bone divided by foramen magnum. Now let's see how to hold this bone in anatomical position. So first of all, what you need to do is, this squamous part has got internal surface and external surface. The internal surface is concave, external surface is convex. So it should be like this initially, and then this foramen magnum should be kept in a horizontal plane in such a way that this basilar part should direct upward and forward. Okay, like this. So another easy way to hold it in anatomical position is on a palm, making it a flat surface like this. Just put this foramen magnum on it and support this external surface of squamous part by your fingers like this, in such a way that this basio-occiput will be directed upward and forward. Okay, so this is the anatomical position. Right, now let's see individual bony part. As I mentioned, it has got four parts: squamous part, basilar part, and two condylar parts. Now let's see first this squamous part of the occipital bone. Now this squamous part has got two surfaces: internal surface, which is concave, and external surface, which is convex. It has got four borders: two superolateral and two infralateral, and three angles: superior angle and two lateral angles. Let's see first the external surface. It is quadrilateral in outline and it is convex. Now near its center it shows a protuberance. This is termed as external occipital protuberance, and highest point of this external occipital protuberance is termed as inion. Now from inion, two arched lines are running from medial to lateral. These are termed as superior nuchal lines. Two another faint lines will also run arching upward from medial to lateral. These are termed as highest nuchal lines. One thick bony ridge extends from inion to posterior margin of foramen magnum in the mid part, and that is termed as external occipital crest. From midway from this external occipital crest on either side, two another lines run. These are termed as inferior nuchal lines. So basically there are three pairs of nuchal lines: two superior nuchal lines from inion, two highest nuchal lines again from inion, and two inferior nuchal lines midway from this external occipital crest. Now these nuchal lines will divide this external surface into different areas, and these different areas will provide attachment to different muscles of back and spine. Now to understand attachment of this muscle, let's see a diagram. Now this diagram shows external surface which is seen from below and behind. Okay, like this. And as we have discussed, over here will be the external occipital protuberance, and its summit is termed as inion. Below to it, a thick crest runs, and that is external occipital crest up to the posterior margin of foramen magnum. Now this provides attachment to ligamentum nuchae. These are the superior nuchal lines. Medially they provide attachment to trapezius, laterally to posterior fibers of sternocleidomastoid above and splenius capitis below. These are highest nuchal lines. Medially they provide attachment to epicranial aponeurosis or gallia aponeurotica, and laterally to occipital bailey of occipitofrontalis. Now area above to it, area above highest nuchal line, this area, the major portion is covered by epicranial aponeurosis, and laterally this area is covered by occipital bailey of occipitofrontalis. area below to this superior nuchal line, this portion, which is further subdivided into 4 quadrants by these inferior nuchal lines. So in the upper part, on either side of the external occipital crest, between superior and inferior nuchal lines, medially this portion provides attachment to semispinalis capitis medially, and laterally this area provides attachment to obliquus capitis superior muscle or superior oblique muscle. Now these are the muscles related to suboccipital triangle. Similarly, external surface below this inferior nuchal line medially provides attachment to rectus capitis posterior minor and laterally to rectus capitis posterior major muscle. Again, these muscles are related to suboccipital triangle. Now this posterior margin of foramen magnum provides attachment to posterior atlanto-occipital membrane. Now this superior nuchal line is a boundary between scalp above and neck below, and this divides the external surface into 2 parts. The area above to it is termed as planum occipitale. The area below to it is termed as planum nuchale. So that is regarding external surface. Now let's see internal surface. It is concave and near its center it shows a similar bulge like external surface. This is termed as internal occipital protuberance. Now this is a meeting point of cruciform sulci. So there are 4 sulci running all around from this internal occipital protuberance, one above, one below and 2 on either side. The upper one is terminal part of sagittal sulcus. The lips will provide attachment to falx cerebri, and this sulcus itself will lodge terminal part of superior sagittal sinus. On either side are transverse sulci. Their lips will provide attachment to tentorium cerebelli and they lodge transverse sinuses. Below to internal occipital protuberance is a crest, and that is running towards posterior margin of foramen magnum. This is termed as internal occipital crest. Its margin will provide attachment to falx cerebelli and itself it will lodge occipital sinus. Towards the posterior margin of foramen magnum, it shows a depression, triangular depression, see over here, and this is termed as Vermean fossa, and this will lodge vermis of the cerebellum. So basically this internal occipital protuberance is a meeting point of 4 sinuses. From above, superior sagittal sinus, from either side are the transverse sinuses, and below is the occipital sinus. So this is termed as confluence of sinuses. Now generally the superior sagittal sinus will continue as right transverse sinus, and so as the sulcus here in this case you can clearly make out. And the straight sinus which is found within tentorium cerebelli is continuous as this left transverse sinus. Okay, so this is the confluence of sinuses. Now there are 4 depressions or 4 fossa related to this cruciform sulci, one on either side of this sagittal sulcus, and these are triangular in shape and they are lodging posterior pole of the cerebrum. 2 below which are quadrilateral in shape on either side of internal occipital crest, and this will lodge to cerebellar hemispheres. So over here there will be attachment of tentorium cerebelli, and this will divide this posterior cranial fossa into supratentorial and infratentorial compartments. So this is regarding internal surface. Now let's see borders. As I mentioned, it has got 4 borders, 2 supralateral borders and 2 infralateral borders. Now these 2 supralateral borders will articulate with corresponding borders of the parietal bones. Now these are the parietal bones connected in the midline at sagittal suture, and along their posterior border these 2 supralateral borders of the occipital bone will join, and together they form lambdoid suture like this. See this is how they are connected, and this is the formation of lambdoid suture. So individual supralateral border will contribute to form half of the lambdoid suture. Now next is infralateral border. So here this is the infralateral border. It extends from lateral angle above to the jugular process below. This is jugular process. This is the lateral angle. So when the supralateral border terminates at lateral angle, this infralateral border commences, and over here it articulates with posterior border of mastoid part of the temporal bone. So this is left temporal bone, this is its mastoid part, and this is the posterior border. Now over here these two will connect like this. See, this is how the articulation will take place, right? So this is the supralateral border, articulates with parietal bone. This is infralateral border, articulates with posterior border of mastoid part of the temporal bone. Now the angles, it is having three angles, one superior and two lateral. The superior angle is a meeting point of sagittal suture and lambdoid suture. This is also termed as lambda, and this is the site of posterior fontanelle of the fetal skull. Whereas the lateral angles are meeting point of three bones: occipital bone, parietal bone and mastotemporal bone. So over here you can see the lambdoid suture, the parieto-mastoid suture and occipito-mastoid suture, they meet, and this is also termed as asterion. This is a site of posterolateral fontanelle of fetal skull. So this is regarding squamous part of the occipital bone. Now let's see basilar part of the occipital bone, or it is also termed as basi-occiput. Now it extends from anterior margin of foramen magnum to the body of sphenoid. Now this is sphenoid and this is the body of sphenoid. So here the articulation between the basi-occiput and body of sphenoid will take place. So this is the basi-occiput. Now it has got three surfaces: anterior, superior and inferior, and two lateral borders. Now let's see first the anterior surface. Now this anterior surface will articulate with the corresponding surface of body of sphenoid by a hyaline cartilage initially, and together they are forming primary cartilaginous joint which gets fused after the age of 25 years. So the synchondrosis will be converted into synostosis. Now next is superior surface, which is sloping, which is extending from basis sphenoid above to foramen magnum below. See over here, and it is directed downward and backward. This is forming part of clivus, and above it is supporting pons and part of medulla oblongata. Between pons, medulla oblongata and this surface there lies basilar artery, its branches and basilar plexus of vein. Near anterior margin of foramen magnum, this surface provides attachment to three structures from above downward, namely membrana tectoria, vertical band of cruciate ligament and apical ligament of Dance. Let me show this attachment in a diagram. So this shows sagittal section from foramen magnum and C1 and C2, and over here you can see this is the posteriormost part of the superior surface of basi-occiput, and this is the anterior margin of foramen magnum. This is posterior margin of foramen magnum. So over here, as we have discussed, three structures are attached: membrana tectoria, vertical band of cruciate ligament and apical ligament of Dance. Now the apical ligament of Dance is remnant of notochord. This membrana tectoria is upward continuation of posterior longitudinal ligament, and the cruciate ligament is a ligament which is cruciform in shape, and that is related to forming joint between atlas and Dance of the C2, that is termed as atlanto-axial joint. Let me show you the same in another diagram. So here in this diagram, this is a posterior view. This is anterior margin of foramen magnum. This is the terminal part of superior surface, clivus, and this is the axis. And over here you can see this is the cruciate ligament. This is the vertical band, upper and lower vertical band, and these are the transverse bands. So this is the cruciate ligament. So this vertical band is connected to the terminal part of superior surface along with apical ligament of Dance and membrana tectoria. So this is regarding superior surface. Now let's see inferior surface. Over here you can see this is inferior surface. Near its center there is a tubercle. This is termed as pharyngeal tubercle, which provides attachment to pharyngeal raphe. Now pharyngeal raphe is a raphe formed by fusion of posterior fibers of superior, middle and inferior constrictor muscles. On either side of this tubercle there are depressed areas which provides attachment to longus capitis muscle. Posterolateral to that, in front of these occipital condyles, there are two other depressed areas which provides attachment to rectus capitis anterior muscle. So two muscles are attached in relation to pharyngeal tubercle. Over here is longus capitis and over here are the rectus capitis anterior muscle. Now in front of attachment of longus capitis, this portion provides attachment to three fascia from behind forward, namely prevertebral fascia, buccopharyngeal fascia and pharyngobasilar fascia. So there is a continuous line of attachment of these three fascia from behind forward. So this is regarding inferior surface. Now let's see borders. As I mentioned, it has got two borders or two lateral borders. Now these borders are connected with posterior border of petrous part of the temporal bone. Let me show you the same in articulated skull. So over here you can see this is interior of the cranium and this is basio-occiput, and these are its two lateral borders. Now these are the petrous temporal bone, these are its posterior borders, and you can see the connection between these two. So lateral borders are connected with the posterior border of petrous temporal bone by sutural ligaments, and over here it shows a groove, and this groove lodges inferior petrosal sinus. Now this sinus will drain into this internal jugular vein, which is situated over here. This is the jugular foramen. So over here there commences internal jugular vein. So it is said that this inferior petrosal sinus is a first tributary of internal jugular vein. So this is regarding basio-occiput. Now remaining is the condylar part, which is situated on either side of the foramen magnum. See from below. So this is the condylar part. Now itself it is made up of two subparts, the occipital condyle and jugular process. These two together collectively termed as condylar part of the occipital bone. Now this condylar part is elliptical in shape and that is situated along the anterior half of foramen magnum, and that is converging. It is having smooth oval or reniform shaped articular facet, and that articulates with superior articular facet of atlas. Say this is atlas and this is a corresponding superior articular facet. So these two together are articulated and they form atlanto-occipital joint like this. See this? Okay. Now just above to that you can see there is a canal above to that condyle, and that is situated approximately at the junction of anterior 1/3 and posterior 2/3 of this occipital condyle. This is hypoglossal canal. Now this will allow passage of hypoglossal nerve, a meningeal branch of ascending pharyngeal artery, and sometimes an emissary vein. Sometimes this canal is showing 2 to 3 spicules, and that will divide the canal into smaller compartments through which the small filaments of hypoglossal nerve comes out. Now just above to this hypoglossal canal, from inside when we see there is a tubercle. Now this tubercle is termed as jugular tubercle. Now posterior part of it is showing some grooves. Let me bring it a bit closer. See over here you can see this is the jugular tubercle, and that is bridging actually the underlying hypoglossal canal. Now along its posterior aspect there are 2 to 3 oblique grooves, and these are lodged by 9th, 10th and 11th cranial nerve, and they will then enter into the intermediate compartment of jugular foramen, which is situated over here. Now when we see from foramen magnum this occipital condyle along their medial aspect, they show, see these are the tubercles, one on either side, and this will provide attachment to alar ligaments. So when we join atlas and axis together like this, and when we join these two with the occipital bone, you can clearly make out that the odontoid process will come in relation with anterior margin of the foramen magnum, and from its sides the alar ligaments are attached and they are then connected above with these tubercles. So these two tubercles will provide attachment to alar ligaments. Now next is jugular process. This is a quadrilateral bony plate projecting forward and laterally from the posterior half of this occipital condyle. See this. This is the occipital condyle, this is its posterior half, and this is the projecting jugular process. Now it is having an anterior notch or anterior margin, a lateral margin, and two surfaces, superior surface and inferior surface. This anterior margin is having a notch, and that is forming posterior boundary of jugular foramen. So when we join it with the temporal bone, see this is right temporal bone and this is petrous part, and when we join these two together like this, just focus on this notch. See this is the formation of jugular foramen, and this notch is forming posterior boundary of this jugular foramen like this. Okay. Now this lateral margin is rough, it is articular, and it is related to corresponding rough area, articular area of the petrous temporal bone, and these two are connected by primary cartilaginous joint which will get fused at the age of 25 years. See this. Just focus on this articular surface, and these two are connected like this. Okay. The inferior surface provides attachment to rectus capitis lateralis muscle, whereas the superior surface is deeply grooved, and that will form terminal part of sigmoid sulcus, and that will lead to this jugular foramen, where the sigmoid sinus is continuous as internal jugular vein. See this. When we join these two together, this is the sigmoid sulcus, which is related to mastoid part of the temporal bone, and that is then continuous with the groove situated on the superior surface of jugular process. See this. Okay. Now the same thing you can see in articulated skull. See over here. This is transverse sulcus, this is sigmoid sulcus, and over here this is the jugular process, which is having notch. So continuation of sigmoid sulcus you can see over here, and this is continuous as jugular foramen. So this portion lodges sigmoid sinus. Now last is foramen magnum. It's a large oval shaped foramen which is the continuity of posterior cranial fossa above with the vertebral canal below. Now approximate diameters in adult are 3.5 cm anteroposteriorly and 3 cm transversely. Now when you see it from below, the midpoint of anterior margin is termed as base zone. The anterior margin is providing attachment to anterior atlanto-occipital membrane, whereas this posterior margin provides attachment to posterior atlanto-occipital membrane. Now as we have discussed, these occipital condyles are having tubercles, and these are providing attachment to LR ligaments. So this LR ligament will divide this foramen magnum into smaller anterior compartment and larger posterior compartment. The smaller anterior compartment will allow passage of three structures, namely membrana tectoria, apical ligament of Dance, and vertical band of cruciate ligament, which are attached over here that we have already discussed. Whereas the larger posterior compartment will allow passage of mainly nervous structures and vessels, like continuation of medulla oblongata in the form of spinal cord, sometimes tonsils of cerebellum, anterior and posterior spinal arteries, fourth part of vertebral artery along with the sympathetic plexus around it, and spinal root of accessory nerve. This everything is covered by three meninges, subarachnoid space, and CSF. So mainly these nervous structures and vascular structures are passing through it. So this posterior large compartment is also termed as neurovascular compartment, whereas a smaller anterior compartment, mainly it is allowing passage of ligament, so it is also termed as osteoligamentous compartment. So that is about foramen magnum. So this is regarding occipital bone. Hope you understood well. Thanks for watching.